I would like to make an appointment for my son. It will be his first visit. What? No, we shouldn't need that long. He's only got one tooth. Am I supposed to brush that one tooth? Just pick anyone? Did you brush their teeth? Crap, I'm not waking him up.
I want to brush my teeth.
They're supposed to brush twice a day?
What is this?
Toothpaste.
E.
Oh, we don't want to put it on. But all the teeth fall out anyway, so we're good. We're good. Are we good? This passy is huge. Which one's not orthodontics approved? This might sound stupid, but if it's orthodontics approved, wouldn't that mean that he wouldn't have a job anymore? Because the teeth shouldn't be moving. Am I right? What are some of the biggest issues you see with children under the age of 3?
Kids under 3 years of age usually come in for something that we call a well baby checkup. It's a very non-invasive checkup. And so at that time, what we discuss with parents a lot are the things that have to do with growth and development prior to getting teeth or just as they have their new teeth. So the main issues that we see at that point are habits such as sucking on fingers, pacifiers, a thumb, any sort of tooth eruption problems, teeth that don't come in at the right time or at the right order, eruption cysts, things that prohibit teeth from erupting properly. And then, of course, we talk about diet and cavities and growth and development in general.
How are the appointments different?
Kiddos under 3 years of age always come in for those well baby checkups. Once they turn 3, at that point, we actually need to do a regular dental checkup, which is the same kind of checkup that adults get when they go to the dentist, plus all the fun things that we try to do for the kids to not feel like they're in a medical facility. So at that time, they will get their x-rays taken whenever necessary. They will also get regular cleaning, and they also get a full exam with a doctor.
Are pacifiers really that bad? And the ones that say orthodontics approved, is there a difference?
Pacifiers in general are meant exactly to do what they need to do, which is pacify kiddos. And what they call non-nutritive sucking is actually a very normal thing that kids do starting in the womb. So it's not a pathology of any kind. Pacifiers can be super useful for kids to soothe themselves. They're also great for parents because parents get some rest, and rested parents are quite important, especially in those early stages of life. So there's nothing wrong with actually having a pacifier. Now, can pacifiers cause pathology such as changes in the bite and in the bone structure and jaw structure? Absolutely. They don't always do that. It just really depends on the kids. It depends on how hard they're sucking on the pacifier. It depends on how long they have a pacifier in their mouth. And it also depends on how soft and malleable all those structures are. So I do see changes in the bite with pacifiers, but I often tell parents that until a certain point in life, it's okay to let the kiddos soothe themselves that way. In terms of different kinds of pacifiers, the truth is that's just a marketing strategy.
Is there a certain age where you're like, okay, they need to be done with the pacifier?
It's not a hard question to answer. Sometimes I see kids who are 3 or 4 years old still on a pacifier, and there's hardly any changes in their mouth. If the parents didn't tell me that the kiddos were on a pacifier, I would never know. At 18 months of age is where majority of the teeth have either come in or are coming in. So it's a perfect time to stop the pacifier before those teeth lock into an appropriate position in the mouth.
With these teeth coming in, what type of brush should you be using?
First of all, everybody should be using a soft toothbrush, whether it's a baby or an adult. And then the second thing is the size of a toothbrush. Clearly, the little guys have tiny little mouths, so the smallest toothbrush you can get is best. And then also, once they start being able to brush their own teeth, it's that size of the handle. Kids can grab onto things that are bigger, better than things that are, tiny little sticks.
What is fluoride?
Fluoride is basically a naturally existing mineral that can replace some of those broken down enamel particles and strengthen teeth. The reason why fluoride has such a bad name is because in large quantities, it can cause fluoride poisoning. I think the bigger issue is that while the teeth are forming, if too much fluoride gets incorporated into those teeth, kids will get what's called fluorosis. And fluorosis means that even though their teeth are going to be super strong, they're not going to look very pretty. They are dark. Anything from brown and yellow and black spots. Sometimes there's even structural issues, but that's mostly related to systemic fluoride, meaning fluoride tablets and fluoride drops that used to be super popular about 20 years ago. If you use fluoride toothpaste appropriately, meaning just a tiny little amount on the toothbrush, and by tiny amount, I mean for little kiddos, like under 2 years of age, it's really a smear or a rice size amount of toothpaste. You're not going to cause any harm to the teeth. And then later on, we're talking about pea size. Pea size is great for older kiddos. Really, even adults don't need to use much more than pea size.
What are some of the big oral health milestones?
So we start getting teeth around 6 months of age. So that's kind of the first big milestone. But when we talk about these averages, those are just averages. Sometimes kids won't get them until 1 year of age. Sometimes they get them as early as 2 months of age. So there's no panic in either way. But between about 6 months and 2 years of age is when we get most of our teeth. Flossing really needs to happen if the teeth are touching. So a lot of little guys are going to have great spacing between their teeth, almost like a picket fence appearance of teeth, which worries parents, but it's actually a wonderful thing because that means that when their bigger permanent teeth come in, we've saved some space for them. So as long as the teeth are not touching, flossing doesn't really matter too much. Adult teeth start coming in about 6 years of age, and at that time, we very highly recommend flossing.
What about mouthwash?
Mouthwash is kind of a tricky one. A lot of mouthwashes are basically soap water, meaning that sure, they're kind of fun, but kiddos will substitute mouthwash for actual good brushing. I think that as long as they're using it, they're good because their breath smells good, especially some of those teenagers. This is where they start skipping out on things. Mouthwash doesn't actually do any of that. To simplify it, there are two kinds of mouthwashes. There are the kinds that have fluoride in them and the kinds that are called antibacterial. The ones that have fluoride in them, we do recommend for kids who are at high risk for cavities. So if I see cavities between the teeth on kids, or if they're in braces and they're not brushing really well, I'll definitely recommend using some fluoride mouthwash in order to keep those cavities away. But the antibacterial mouthwashes are good for gum disease, and most kids don't really have gum disease.
Any tips or tricks to help kids that hate getting their teeth brushed?
So what I recommend to parents is, number one, make it fun. And if two parents are at home, you can do what we call a knee-to-knee exam, where parents are touching knees, sitting in a chair, and then they just kind of flip the kiddo over to one parent. So one parent just gets the head while the other one gets all the wiggly parts, all the legs and arms, and plays with them that way. Now, some parents say that they do it in the bathtub, which is great. You can go ahead and have a kiddo in the bathtub and brush their teeth. I do think that you probably get to all the parts in the back best if they are laying down.
Teething, is there something you recommend using versus not using when it comes to that?
It's an annoying experience. Something is happening back there. Sometimes it's just that the gums are a little swollen. Sometimes there's a sharp little cusp coming through, but they just have no idea what it is. So that's why usually they're annoyed about it when they're little, more than that they're actually in pain. That said, teething is a real issue. Those teeth are coming through. They're coming through the tissues. And kiddos start teething at about 6 months of age. Usually it's harder for them to get some of those first teeth than it is to get the big molars in the back. But the most problems, I would say, parents report between 6 and 18 months of age. In terms of what we recommend for teething, Tylenol or ibuprofen are always great, just because, they soothe actual pain. But we don't always want to use medications on our kids. So if we don't want to use medications, anything that they can chew on that soothes them that way works.
Advice for new parents when it comes to dental hygiene.
Despite all of the advances in fluoridation of water and in sealants, we see a lot of kids that are 2 and 3 years of age with pretty serious dental problems in terms of cavities. It's not hard to get cavities. All it takes is just bacteria. So I definitely think that number one thing you can do for your kiddo is to make it to the dentist by about 1 year of age. Doesn't matter how many teeth your kids have at that point. It's mostly for you as a parent. Second thing is make sure that your kids go to bed with clean teeth. My name is Kasia Lindhorst, and I am a pediatric dentist in Houston. I have lived in Houston for over 30 years now, and started my practice here about 15 years ago. I have actually 2 practices. One of them is in the Memorial area and one is in the Heights area, and they are both pediatric dental only. So we only see kiddos and teenagers in our practice.